Hello everybody, welcome to my YouTube channel Homeopathic Super Sessions by Dr. Jagos. Today I'll be telling you in brief regarding case taking in homeopathy. Well, case taking in homeopathy will be done according to the directions given in the Organon textbook. So for that we have to refer aphorism number 83 to 104. Well, in case taking, here we have to individualize the case, which is of utmost importance. Therefore, individualizing examination is of the greatest importance, and only general directions will be discussed in this video. So as you all know, individualization is the essence of homeopathy, and homeopathy becomes a super specialization because it is the only pathy in which we individualize the person. So therefore, individualizing gains utmost importance in case taking. So now let us see how to take the case by giving general directions. Before that, we have to see what qualities a homeopathic physician should possess in order to take the case correctly or successfully. So for that, our great master, Dr. Samuel Hahnemann, has said that the homeopathic physician should have freedom from prejudice. That means he should be an unprejudiced observer. He should not have any prejudiced idea in his mind, or else he will go off track, or something which is in front of his eyes, he may miss that out because of his prejudiced nature, or prejudiced mind, or prejudiced mindset. He also must be in his sound senses. That's also very important. And he should have attention in observing. So he should be very careful, and he should completely focus on the task of taking the case with great attention. He should also have fidelity in tracing the picture of the disease. That means he must accurately trace the picture of the disease. He must also have circumspection, meaning he has to conduct the case taking or the interview technique with caution. He should have the tact. That means if any question he wants to ask and if the patient is not obliged into answering, then very tactfully he has to go and ask the patient certain questions in an indirect manner so that the patient will be obliged into answering them. So for that also, the physician should have a knowledge of human nature, and also he must have caution in conducting the inquiry. For example, no direct questions are to be asked, and naturally, the physician should have patience to an eminent degree. As you all know, that in a chronic case taking, a lot of time is taken, and the patient and the physician both have to be patient in order to find out the correct simile. So before I go into the directions given in the Organon text by Dr. Hahnemann, I would like to introduce the fourfold function of a physician by Hippocrates. So if you study the history of medicine, Hippocrates has already told you that the physician should have these four main functions. The first is to take care of the sick. That means caring, concern, and compassion. To teach his fellow physicians, that is sharing the knowledge. To observe and record the disease phenomena, that is scientific attitude of mind, that is sound knowledge. And lastly, which is very important, ethical ideas in life and living, that is the mission or the dedication. Hahnemann says service before self. In short, altruism, meaning devotion to the care of others. So your whole life as a homeopathic doctor should be devoted to the care of others. So this is very important. Hippocrates has given the qualities or the functions of a physician. So the four main functions of a physician given by Hippocrates, as you all can see, is on the screen. And Dr. Hahnemann has also taken this from here and also incorporated into his Organon textbook. Now, let us come to the main point, the procedure for case taking as per the directions given in Organon, aphorism number 83 to 104. The patient details the history of his suffering. Those around him tell what they heard him complain of, how he has behaved, and what they have noticed in him. The physician sees, hears, and remarks by his other senses what there is of an altered or unusual character about him. So that means what? As the patient enters the clinic, the patient will naturally narrate the sufferings and the physician will quietly note it down. And when the patient is telling him the complaints or the chief complaints, the physician will be attentive and he will try to notice what is abnormal in the patient, how the patient is behaving, how he is sitting, how he is talking, etc., etc. So the physician will see, he will hear, and he will also take note of the remarks made by others or whoever is accompanying the patient, and he would identify what is altered or an unusual character about the patient. The physician writes down accurately all that the patient and his friends have told him in the very expressions used by them. This is very important. Whatever expressions are used by the patient, the same expressions has to be written down. That means whatever the patient is telling you, you have to write it down in the same words as that of the patient. Keeping silence himself, he allows them to say all they have to say and refrains from interrupting them until they wander off to other matters. So the physician will keep silence and he'll allow the patient to speak all what he wants to say of his own accord, and he doesn't interrupt the patient unless and of course the patient wanders off the topic or wanders off the point. The physician advises the patient at the beginning of the examination to speak slowly in order that he may take down in writing the important parts of what the patient says. So in the initial part of the interview, the physician will just brief the patient what is about, about homeopathic case taking, that it takes time, many questions will be asked, you have to answer all these questions. You may be thinking that some questions are irrelevant, but they are relevant to a homeopathic doctor. So hence I'll be asking you all this. So he will advise the patient to speak slowly so that the physician will be able to write down everything what the patient wants to say. However, every interruption breaks the train of thought, and all they would have said at the first does not again occur to them in precisely the same manner after that. And naturally, the physician will not interrupt the patient, because if you interrupt the patient, the train of thought has been disturbed, and what the patient wants to say, he may forget and he may not tell the physician, which may be of prime importance also. The physician begins a fresh line with every new symptom or circumstance mentioned by the patient or his friends, so that the symptoms shall be all ranged separately, one below the other. So basically, the physician will write down each new symptom on a new line, and he will arrange it one below the other, leaving some space between the symptoms, so that later on, when more special questions are asked or when more precise questions are asked, the physician will be able to write down more details about the same. That is why some space has been left between the symptoms. He can thus add to one that may have first been related in too vague manner, but subsequently more explicitly explained. Also, initially the patient may not be in a position to explain you the symptom properly, but later on, after thinking, or later on, the patient may tell you something more about the symptom. So whatever space you have left between the symptoms becomes useful to complete the symptom. When the patient and the accompanying persons have finished what they would say, and the physician then reverts to each particular symptom and elicits more precise information. So basically, when the patient has finished narrating all what he wants to say of its own accord, and whoever is accompanying the patient also have finished narrating something about the patient, then the physician would go through the case or would go through each symptom, what the patient has said, and will elicit more precise information. He reads over the symptoms as they were narrated to him one by one, and of each of them he inquires for further particulars. So what will the physician do then later on? He will read out each symptom which was told by the patient to the physician one by one. So he'll take the first symptom, then the second symptom, then the third symptom, and for each of them, the physician will inquire into further particulars. Now let us see what you mean by that. For example, the physician may ask, at what period did this symptom occur? Was it previous to taking the medicine he had hitherto been using, or while taking the medicine, or only some days after leaving off the medicines? What kind of pain, what sensation exactly was it that occurred on the spot? So he may ask that, these symptoms, what you have told me, did they occur? At what time of the day did they occur? Was it before, during, or after taking the allopathic medicine that these symptoms have occurred? What is the exact type of pain? Can you explain it to me? What is the exact sensation? What is the exact location or the spot of the pain, etc., etc.? Or what is the precise spot? Did the pain occur in fits or by itself or at various times? Or was it continued without intermission? How long did it last? At what time of the day or night? And in what position of the body was it worst or ceased entirely? What was the exact nature of this or that event or circumstance mentioned, described in plain words? So again, these are the other important questions which the physician may ask the patient in order to make the symptom complete, or to get more information which will help him to prescribe correctly. And thus the physician obtains more precise information. In doing so, the physician always frames his question in such a manner that it will never suggest the answer to the patient, so that he shall only have to answer yes or no. So basically, in short, the physician will ask the question in a very indirect manner. Otherwise, the patient will just say yes or no if asked in a very direct manner. For example, if the physician asks, suppose the patient says, I have headache. So the physician may ask, if he's prejudiced, he will ask, do you have throbbing headache? So the patient will have only two options, either to answer yes or no. But you have to ask in an indirect manner, saying that what type of pain are you experiencing in your head? Can you please elaborate on that? So then the patient will tell you the different type of pain he is experiencing. So therefore, he has a much greater option to explain to you in detail about the pain if an indirect question has been put towards the patient. Otherwise, he will miss to answer in the affirmative or negative, something untrue, half true, or strictly not correct. So if you only give him, if you ask a direct question, so you'll only give him two options, either to answer yes or no. So what will happen? The patient may mislead you to the answer. Or he may say something which is untrue, or maybe partially true, or which is strictly not correct. This occurs either from indolence or in order to please the interrogator, from which a false picture of the disease and an unsuitable mode of treatment must result. So why will he answer either in yes or no? Because the patient may be indolence, meaning lazy, or he wants to please the physician. He feels scared that if he answers no, the physician may get angry. So in order to please the interrogator, he will answer either yes or no. And naturally, so whatever direct questions you are giving the patient, and whatever answers you are getting, it may frame a false picture of the disease, and as a result of which an unsuitable mode of treatment will result. So naturally, if you do not take the true portrait of the disease or the true picture of the disease, then you will not be able to find the correct simile. So the true portrait of the disease is absolutely essential in order to find the exact simile. So therefore, do not ask direct questions, always ask indirect questions. If the patient voluntarily does not tell the physician the symptoms pertaining to some part of the body or his mental state, the physician must make use of general expressions so that the patient is obliged into answering it. So it may be so that the physician will ask a question and the patient may hesitate, or he may not want to answer the question which may pertain to some part of the body or about his mental state. So the physician should do what? He should make the use of general expressions so that the patient spontaneously will be obliged to answer it. For example, what is the character of the stool? How does he pass his water? How is it with the day and night sleep? What is the state of his disposition, his humor, his memory? How about the thirst? What sort of taste he had in his mouth? What kinds of food and drinks are most relished? What are the most repugnant to him? Has each its full natural taste or some other unusual taste? How does he feel after eating or drinking? He has anything to tell about the head, the limbs, or the abdomen. So this is again an indirect way of asking. When the patient has given all the answers, what the physician has asked, so the disease picture can now be formed. So after asking these special questions, the symptoms which were incomplete, they become complete, or the symptoms which are not true, they become true after reconfirming the expressions of the disease. But at times, the physician may ask more special questions in order to complete the symptom or the disease picture which was incomplete. However, it may be that in spite of asking these special questions, still the symptomatology remains unclear or the symptoms remain incomplete. So what will the physician do? The physician will ask more special questions so that to complete the symptom which was incomplete or to form a correct, clear, crystal clear image of the disease. Thus, the physician will ask more precise or special questions. Now, let us see what are these more precise or special questions. For example, how often are his bowels moved? What is the exact character of the stool? Did the vitus evacuation consist of mucus or feces? Has he or had he not pains during the evacuation? What is the exact character and when were they seated? How does he behave during sleep? Does he whine, moan, talk, or cry out in his sleep? Does he start during sleep? Does he snore during inspiration or during expiration? So these are the more special or more precise questions to be asked. Furthermore, Hahnemann writes, does he lie only on his back or on which side? Does he cover himself well up or can he not bear the clothes on him? Does he easily awake or does he sleep too soundly? In women, note the character of menstruation and other discharges, etc. So when the physician has finished writing down these particulars, he then makes a note of what he himself observed in the patient. So this is very important. After the physician has taken the case, he has asked special questions, he has asked more precise or special questions, and then he'll make an observation of what he has noticed about the patient. That means whether he was nervous, whether he was angry, how he is behaving, what is the expression of the face, is he frowning, is he smiling, is he crying, etc. He ascertains how much of this was peculiar to the patient in his healthy state. So therefore, whatever deviation has taken place, he will compare it to the healthy state. That in the healthy state, he was happy and jolly, and now in the disease state, he becomes sad and morose. So he will confirm this with the help of the symptoms, with the help of the persons who are accompanying him. They will also tell him something about it. So taking into the whole totality, the physician will ascertain how much was peculiar to the patient in his healthy state. For example, how did the patient behave during the visit? Whether was he morose, quarrelsome, hasty, lachrymose, anxious, despairing, or sad, or hopeful, calm, etc. Whether he was in a drowsy state or in any way dull of comprehension, whether he spoke hoarsely in a low tone or incoherently. Please remember that the symptoms and feelings of the patient when he's on medication does not tell us the true picture of the disease. As I've told you right in the beginning, the special questions were asked whether these symptoms were before, during, or after taking the allopathic medication. So remember, when the patient is on allopathic medication or on modern medicine, then the true picture of the disease cannot be obtained. So for that, you have to have tact, you have to have circumspection, you have to perceive the case properly, and then you have to find out the true picture of the disease. Thus, the true picture of the disease will be obtained only if the patient discontinues the medicine or he tells us the feeling of symptoms before starting the medicine. So, therefore, in order to trace the correct portrait of the disease or the true picture of the disease, you have to ask the symptoms before the medicines were started. Or, if possible, you discontinue the medicine, give a placebo, give some time for the allopathic medicine action to wean away, and then again retake the case, and then in this manner, you will get a true picture of the disease. So this is all what I want to say for today's video, the general directions of case taking. In my next video, I'll be telling you about how to take an acute case, how to take a chronic case. So please do subscribe to my YouTube channel if you like my presentation. This channel is related exclusive to Organon. It is easy to understand and remember. It is simplified in a way which I think it is very best for the students to remember. It contains all important topics of UG and PG syllabus. It has to date around 67 videos. And I've also introduced short descriptions of commonly seen diseases, which will help you in order to have a successful practice. Important tips how to crack the examinations, viva questions, theory questions, and much more. So please do subscribe to my channel and do pass on the words to other people from your college or from other people from different states so that also they can be benefited. Thank you very much. I hope you enjoyed the lecture.